Well, a simple scan that costs just $99 could predict if you're going to have a heart attack. News 8's Lena Pringle has the details on how a test score can save your life in today's Health Spotlight.
Heart disease is the #1 killer of men and women in the United States. It affects all ages, races, and genders. In fact, one person every 33 seconds dies from coronary artery disease. Do you want to know your risk of having a heart attack? Because there's a new heart test that you may need, but probably have never heard of. From monitoring blood pressure, cholesterol, and diabetes to undergoing mammograms, PSA screenings, Pap tests, HIV tests, and skin cancer examinations. As we age, the roster of recommended medical tests gets longer and longer. And now, get ready to add another to the list.
The coronary calcium score is actually a CAT scan. It takes 2 minutes to acquire the images and very little radiation involved. And what it does is it looks at your coronary arteries to see if there's any calcium in your coronary arteries. And if we find calcium, it's equivalent to having coronary artery disease.
The CAT scan is then used to create a scale from 0 to 400. A score of 0 means there's no plaque present. The higher the score, the more plaque. But Baptist Health cardiologist Pamela Rama says even a low score doesn't mean you're in the clear.
Even a score of 1 means that you have coronary artery disease. What draws the calcium into the coronary arteries is cholesterol plaque. So for me, it's the best predictor of cardiac events that we have so far.
Not only can it determine your risk, but Dr. Rama also uses it to determine if her patients need cholesterol medications like statins.
When I have patients who have high cholesterol levels and their coronary calcium score is 0, I actually stop their statin therapy and they love it.
The only people who don't need the test, anyone who has already been diagnosed with coronary artery disease. This is just one of the many ways to test your heart health. And Dr. Rama says it's not a test that needs to be repeated every year, but she does suggest repeating it in 5 years if you score 0. She also recommends it for people over 45 or younger if heart disease runs in the family. It's usually covered by insurance, but if not, it costs about $100. I'm Lena Pringle for Wish TV, wishtv.com, and like us on Facebook.